Hello, I'm Kirk Coury, and I am delighted to present to you the healing essence of endodontics, saving teeth and restoring health. This presentation was originally given at AAE 24 in LA. So if you missed it there, here's an opportunity to see it in its recorded version. Just a second, I want to give you a little bit of background about me. I graduated from Baylor College of Dentistry, now Texas A&M, in 1987. I practiced general dentistry for a year in Dallas, and then I returned to my endodontic residency program in University of Texas, Houston, and got out in 1990 with a certificate in endodontics and a master's in dentistry. And then I opened my practice in Amarillo, Texas in 1990 as the first endodontist ever to be here. And I am proud to be a diplomat of the American Board of Endodontics. I'm also proud to have served on the AAE Board of Directors and the Foundation for Endodontics. I am a founding partner of US Endo Partners, now Specialized Dental Partners, and I have been using GentleWave since 2018. My story kind of goes like this. As I kind of alluded to, I've been practicing endodontics for 33 years, and 6 of those years have been using GentleWave. And if you'd have asked me 6 years ago if I'd be standing here today talking to you about this amazing technology, I'd probably told you you might be a little bit crazy. Yet here I am, a skeptic, gone from skeptic to a raving fan, and it has literally revolutionized the way we practice endodontics as compared to what I was doing 6 years ago. We were at the time 75–80% single visit endodontics, and 2 visits on necrotic cases, retreatments, etc. And now here we are, thanks to GentleWave, we're literally 99% single visit. Rarely do I bring a patient back unless the tooth cannot be dried and then sealed. One of the things, and this is across the board, you've heard it time and time again, and it's nothing but amazing, is that GentleWave produces less postoperative pain in our patients. It's not just in Amarillo, Texas. It's anyone who uses GentleWave can attest to that. And what that does is that equates to a better patient experience, and that is a huge practice builder, I can tell you. And then for me, after practicing for so long, I was getting a little burned out, and this has made endodontics fun again. It really has. I mentioned it. It's revolutionized our practice for the better from top to bottom. To date, my partner and I have successfully and safely performed over 6,500 GentleWave procedures on our patients. And so much so now that patients come for GentleWave, our referrers send their patients for GentleWave. And we are truly a full-blown GentleWave practice. And I think what's interesting to know, and it's important to know, is that to date, 1.5 million teeth have been treated with GentleWave. Sonendo continues to strive to find ways to improve the overall effectiveness of this technology. CleanFlow is the most recent advancement, with well over 250,000 cases now treated with CleanFlow. For those endodontists who find it hard to let go of their legacy concepts of shaping, this will be a welcome advantage in that CleanFlow seems to be pretty agnostic to the instrumentation techniques and critical anatomy, mainly because of the advanced mechanism of action. So in essence, this definitely expands the types of cases one can confidently treat with CleanFlow, making it really great for new GentleWave users and all of us veterans. Let's talk about successful endodontics. When we think about what makes root canal treatment successful, we want to obviously alleviate any pain and swelling. And if there's a sinus tract, we want resolution of that. And then at follow-up, which follow-ups are important in endodontics, we want to see radiographic evidence of healing. And probably most importantly, we want to restore the tooth back to function. That's really what the name of the game is. But let's drill down just a little bit. Let's talk about healing. Our ultimate goal is to have the patients to heal. That's what we really want to see, right? We want to see the bone heal. We want to see the lamina dura reestablish itself around the root ends. But many variables come into play when we talk about this. We have to remember that every tooth is attached to a human being, and therein lies the challenges. So at any given time, healing or a favorable response, as I like to call it, can be a bit of a moving target and not always what we may consider ideal. So let's talk about healing. We have healed. Healed is functional, asymptomatic, no or minimal radiographic evidence of pathosis. Non-healed, obviously, is one that is non-functional, symptomatic, with or without evidence of periapical pathosis. And then this is probably the one we see most often, especially if we're following these cases at 4 months, 8 months, a year, what have you, as you go through that healing process. These are teeth that may have some radiolucencies, but they're asymptomatic and functional. Or the teeth may not have any radiolucencies, but they still may be symptomatic. But the key part here is that they are still functional. So kind of the moral is that a treated tooth, we want it to be functional, and it is serving its intended purpose in the dentition. So I explain that to patients all the time. Listen, they'll say, well, my tooth still hurts, if I tap on it. Well, obviously the joke is, well, let's cut off your finger and your tooth will get better. But can you chew with it? Yes, I can chew fine. Great. You're healing. Give it some more time. And so patients understand that. They just want to make sure that something isn't going wrong with their tooth. And we all know the bacteria and apical periodontitis are not our friends. And our job as endodontists is to do whatever we can to the best of our abilities to alleviate bacteria and their toxins, the inflamed or infected tissue within the root canal system, so that we have the best chances of success in returning the tooth to full function. For me, GentleWave is the missing piece of the puzzle that allows me to honor and protect that precious pericervical dentin and to thoroughly and simultaneously debride and disinfect the entire root canal system, including those fins, anastomoses, irregularities that Dr. Hess so many years ago in 1917 showed us that exists within the teeth that we treat. This is just a case that I did, tooth number 21. You can see a relatively large root canal space, large lesion, and the apex kind of opens up and has that blunderbuss appearance. This was, for me, a perfect GentleWave case. I opened the tooth and used GentleWave, did very minimal shaping just to make sure I had a nice continuous funnel shape that would facilitate good obturation. And here's the final result. This case has not been, is not an old case. We're in the process of following it. And I love the fact that this patient presented with some pretty significant discomfort, no sleep the night before, significant healing. And this is what my assistant showed me after we used GentleWave on this case. And what you have to understand is this patient's swelling went down literally 75%. And she was well into the healing phase long before I even took the rubber dam off. So traditionally, we would probably have seen this patient a couple of times, put calcium hydroxide until we saw evidence of at least clinical resolution of the infection before we would obturate. This case was dried and it was obturated, and the patient was out of pain 10 hours later, slept all night long, and now is literally a walking billboard for Amarillo Endodontics and for GentleWave. Here's the next case. Number 19, you can see the radiolucency in the furcation area. One might think that this tooth is fractured, and certainly that was at the top of our list. And sometimes what we like to do is we'll do what's called a working diagnosis. We'll literally numb the patient, make an access, and look inside the tooth to determine if it has a fracture or if it does not. In this case, we did do the working diagnosis. The patient wanted to try to save the tooth if at all possible, and we did not detect any internal fractures, so we proceeded with treatment. And I always like to just diagram out what we're going to do and show the patient what the challenges are. And this was just part of that process of informing the patient what we were preparing him for. And I always talk about GentleWave, or my assistants while the patients are getting numb are prepping the patient, telling them what to experience, the sounds they're going to hear, and why we feel like it's a better way to treat the root canal. And this was the minimally prepared and maximally cleaned number 19 after obturation in a single visit. And then you can see in 3 months, we're starting to see nice resolution of the lesion and osseous regeneration. The next case, number 19 again, you can see, again, pretty significant radiolucent lesion on the distal aspect of the mesial root, and on the distal tooth was, GentleWave was utilized. We obturated. You can see multiple portals of exit along the length of that radiolucency on the distal aspect of the mesial root, and just a different angle here. And here we are at 4 months with very, very nice and what I would call substantial and early resolution and healing. Patient had returned to function. Another case, number 31, a very long tooth, and you can see the patient was in lots of, or had significant issues with this tooth. The patient presented with some discomfort. No swelling, of course. The cortical plate had not been eroded, but lots of pressure under the tooth. Patient was lots of pain. So we opened it, ran our GentleWave, and this was the result, single visit result. Lots of things happening along the distal aspect of that mesial root, as is evidenced by the sealer. Here's our 6-month follow-up, our 1-year follow-up, and 2-year follow-up with continued function and asymptomatic status. This was my partner's case, Dr. Douthit. And when I show you this, we like to joke about this case because this is what we call trash or treat. Because when you look at this, you just begin to tell the patient, listen, there's absolutely nothing we can do for this tooth. There's literally no bone. It's probably fractured. And she's a high-profile patient here in Amarillo, and she wanted to do whatever we possibly could to save it. So we went in, did a working diagnosis, and did not see a fracture. So Jim proceeded to treat the tooth, and this was the post-operative result just after we ran GentleWave. And beautiful case. You can see that little extra kind of radio opacity on the mesial root, and that's an MB2 coming in that he was able to capture, even though he did not get an instrument into that space. Here we are at 3 months with unbelievable, surprisingly unbelievable results. Patient is so happy. Being who she is to this day again, a walking billboard for this practice and for this technology, has referred lots of patients because of the technology. And here we go at 6 months, and things are looking really, really nice. And 4 years. Can you believe that? Really, it's an unbelievable case. And I attribute the healing of that case to GentleWave. The significance of this was, it's my very first GentleWave case ever in June of 2018. And this was the result that I got, and still kind of utilizing some of my previous instrumentation techniques, and sent the patient back. And guess what happened? Here she comes back 6 years later, no restoration, but completely healed, completely functional. And I just thought that was the greatest case to be able to follow that up and have her come back. And she just actually came back for another tooth, and I was able to capture this. So why GentleWave? What we first thought was absurd and kind of an impossibility has lived up to the claims and has turned out to be a fun, efficient, and predictable way to perform root canals and enjoy saving teeth. So much so that everyone, almost without exception, receives a GentleWave root canal at Amarillo Endodontics. Recognizing that there are many other ways to so-called skin the cat and disinfect the canals we treat, for me, it really is only GentleWave that provides the results in a predictable, consistent fashion that I rely on that in my practice because it brings me joy. It brings consistency in the practice in our day-to-day. It's predictable. I know that 99 times out of 100, when I perform a GentleWave root canal on my patients, that they're going to have little to no postoperative complications. Let's talk about productivity, the bottom line. We've all heard of ROI, or return on investment. And this is typically that tangible stuff, the numbers that we put to it, that you can quantify the return. And it involves some sort of cost and reward and probably some risk. And it can vary from practice to practice and individuals within the practice. And so when we decided to invest in GentleWave, we honestly did so without consideration of how much, if anything, it would bring to our bottom lines. We invested solely on its efficacy and what benefits others were witnessing firsthand in their practices. So on the other side of that line is what we call VOI, or value on investment. And this involves those intangible things that contribute to your performance but can't be necessarily measured by, or like, what's our why? What's our good enough? How does it enhance patient outcomes? Or what benefit does it bring to our team and to our practice? What do our referrals, see when we're starting to show and share with them this technology? So surprisingly, we were surprised when we saw this. We were happy to say that within a few months, we were able to realize not only the ROI, like we were up 14% in 6 months, and the VOI in terms of what GentleWave brought to us. And obviously, we want, monetized return on investment is never a bad thing. And believe me, GentleWave has done that for us. We're more efficient, we're more profitable than we've ever been. And it's directly attributed to the efficiencies that GentleWave has offered. Instead of value on investment, though, my good colleague and friend, Michael Ribera, calls it value on life. And each of these technologies that you see listed here, that we've all, and by the way, we've all had to struggle. And did we accept them early, or did we accept them midway? Or did we finally see that everyone was using it and we realized it really was sort of, the standard by which we wanted to practice? All of them has done just that, brought value to our lives in one way or another. So in addition to this positive ROI, GentleWave and these other technologies in our contemporary office are career enhancing. They're life enhancing technologies that has transformed not only our office culture, our referral relationships, and patient experiences, but it has transformed us, our minds and bodies, in ways that really is hard to quantify. And GentleWave has played a significant role in that for us and for many of my colleagues who have discovered the benefits of this amazing technology. So what makes GentleWave different and so effective and efficient? It's the only technology that has a relatively standardized protocol. However, I am happy to say recent modifications in the software is going to allow some user modifications in terms of time and concentration of the sodium hypochlorite cycle. Nothing out there today debrides and disinfects all of the canal systems simultaneously, including the pesky apical third and undetected intricate spaces like GentleWave can. It's been shown to dissolve tissue in all canals simultaneously 7 times faster than any other irrigation technology available today. It's completely single-handed, meaning it doesn't require an assistant to suction fluids and aerosols. Patients love the technology and provides them a pleasant experience in that they tend to want to share with others. and particularly back to their general dentist who referred them. What we love most is its efficient, predictable, and consistent way that it performs in every tooth, irregardless of how the patient presents, whether it's acute apical periodontitis, abscess, it doesn't matter. GentleWave seems to perform very consistently, and we depend on that consistency when we're treating our cases. Every indication shows that in most cases, healing occurs more rapidly. And as I mentioned, there's such a peace of mind knowing that patients are typically going to respond favorably. And if not, if there's no other reason to love GentleWave, that's it. Thank you so much for your attention. I hope you enjoyed the presentation and have a great day.